Hi, my name is Dr. Ansel Johnson, and November is Diabetes Awareness Month. And I want to take the time to kind of go over some things as they relate to me as an optometrist and how we help our patients preserve their sight from even when you're living with diabetes, and how to live your best life with diabetes with your best eyesight. Now, first of all, diabetes can be very devastating to your own personal health, and it's already more than an epidemic in our communities. The pandemic has also brought out that people at risk or living with diabetes are more at risk for other health ailments. But I want to focus a little bit about on eye care, and one of the senses that most people really are fear of losing is their eyesight, and that is their most valued sense. So, talk to you a little bit about the prevalence of diabetes. Now, by the numbers, by 2050, 1 in 3 Americans are predicted to be living with diabetes. And there are already 12 million seniors with diabetes, and we're living longer. So as we age, the diabetes is going to be more and more common. However, we're also noticing that our children are more commonly living with diabetes, and it's predicted that all of our children that are born after the year 2000, about 50% of them will be living with diabetes. Now, these are trends we really need to turn around, folks. It's holding back our economy because so much money goes into care of people living with diabetes. You have your medications. People living with diabetes are more commonly prone to kidney dialysis. We see so many dialysis centers rising up in our communities and neighborhoods because of people living with diabetes that is progressing. Amputations is another aspect. And of course, blindness. Diabetes is the leading cause of blindness in adults in this country. Now, these are all trends that can be reversed or even slowed down. And so I'm going to start off with talking about pre-diabetes. Now, personal testimony, I'm an eye doctor that's living with type 2 diabetes. And for a long time, I was told I was borderline, I was metabolic syndrome, and I was always at the mindset, well, I'm going to get ready to really take care of myself and change that trajectory. I was an athlete in high school and in college, but getting back to that level of activity was tough because I was seeing patients, I was taking care of other people, and I had to stop. God kind of taps you on the shoulder with a health crisis where you really have to start taking care of yourself. And so I really talk to patients a lot about pre-diabetes. If they know, they've been told that they need to watch their sugar, lose a little weight, that their numbers on their blood tests are a little borderline, you need to start thinking like a person living with diabetes, because you can reverse that whole trajectory. But being told you're borderline diabetic, you have to have the mindset that you're living with diabetes and make those changes in lifestyle. Food is your best medicine. Food is 80% of it. And I'm going to talk a little bit about how good food and good diet, an improved diet, and selection of things that can actually help your eyesight, supplementations that can help your eyesight and help preserve what you have. So borderline diabetes is something that's an opportunity to start taking things very, very seriously and actually change the trajectory of your health. Obesity is another problem that we all have. I'm still technically obese, even though I've lost probably over 40 pounds over a couple of years. But obesity, being overweight, is a huge, huge factor in terms of having diabetes and complications. Now, with that obesity, if you have a thick gird or a stomach that is outcropped a little bit, a big stomach, that is the most unhealthy fat you can have around the waist. So really, really at risk, if you're a man that has a waist size of 40 or more, 40 inches or more, or a woman with a waist size of 35 or more, that is the most unhealthiest fat that you can have around the gut. And so we all need to focus on not only weight loss. I talked about obesity, being overweight, and not to fat shame anybody, but what we have to think about changing our mindset. It's not about trying to be slim and trim, but about healthy, being a healthy weight. Because medical science can keep us alive for quite a while, but it's up to us in terms of the quality of life that we want to have in retirement or as we get older, the amount of energy that we want to have. That's all important. So think about quality of life. Think about how you want your fitness and you want your life to be 5 years down the road, 10 years down the road, 20 years down the road. I don't care what age category you have. You're never too old to change your lifestyle and to eat healthy, to be healthy. So with that being said, is that food is your best medicine. So let's start with diet. We see patients in our office, and I talk about patients that are borderline diabetic or pre-diabetic. First of all, it's important to know your numbers. You need to know your blood pressure numbers, you need to know your cholesterol numbers, and you need to know your A1C. A lot of times we go to our doctors and they say, oh, your numbers are good, or your numbers are high, your numbers are the same. You as the patient, because healthcare is becoming more patient-centered, need to know your numbers. You could be high normal, you could be borderline, or you can be a little above abnormal. So it's like a meter. It's like a gauge in terms of how good you are. A1C of 5.7 to 6.4 is borderline. So if you're 6.3, that's a lot different from being a 5.8. So that's why it's important to know your numbers. It's important to know your levels of cholesterol. A lot of times cholesterol can be controlled by diet instead of medications. However, with all this advice that I'm giving you today, you have to really work with your healthcare practitioner, your primary care physician, or your internist, or your nurse practitioner, or your PA. Ask them about what numbers you are optimal for you and the medication. So again, all that I'm going to share with you today, please run it by your primary care physicians, those people, or your endocrinologists even, that are managing your diabetes or your pre-diabetes. Now, another aspect we talked about food a little bit. So a lot of my patients, when I talk to them about food, they say, well, I know what to do. I know I need to eat better. Okay. But I don't let people get away with that. Specifically, what are you going to do? Well, a lot of times it's easy. People that drink a lot of soda can cut back or decrease soda. I don't like to talk about, well, I got to eliminate this and don't do this and don't do that. I like to talk to people about cutting back, tapering, and again, having SMART goals. SMART goals are specific, measurable, attainable, realistic, and timely. So in other words, I'm going to lose some weight. It's not good enough. I'm going to lose 1 pound a week over the next 3 months. It's a lot more realistic for people. So that's what I mean by SMART goals. Well, I'm going to eat better. Well, I'm going to cut out fast food. So I'm not going to do anything where I drive through and get food. I have one patient that shared with me anything that she can get in terms of eating through a drive-through window, she's given up. And she's doing wonderful. Just those little things like that. In my own journey, I stopped doing the drive-through fast food, and that made a tremendous difference. And how does that connect to the eyes? Well, let me tell you. Diabetes causes damage to the blood vessels, specifically the small, fragile blood vessels that are throughout the body. We have very small, fragile blood vessels in the eyes. We have small, fragile blood vessels in our feet. So you get foot ulcers. You get small, fragile blood vessels in the heart that can be affected as a heart attack. In the brain, that if affected can lead us to stroke. What most people don't realize is that most people from diabetes die from heart failure, heart attack, stroke, not necessarily just having high sugar, because it is a multifactorial. In other words, there's a lot of different factors that affect the diabetes. It affects every organ in the body. And a lot of times the first signs that we see are someone that comes into our office with blurred vision. And why the blurred vision? Well, we have little lenses inside the eyes, just like a camera lens. And when your blood sugar is fluctuating up and down, up and down, up and down, that changes the shape of the lens and changes your vision. So it's important to keep your blood sugar at a normal level, steady level. And sometimes when people are just started on medications and their blood sugars are dropping, I like to wait a while, several weeks, for their blood sugar levels to stabilize when they've just been put on medications. So they're not having to change their glasses every 2 or 3 weeks. That gets expensive, folks. So you gotta take control. And we look at a patient-centered approach. So we want to engage the patient. What can you do? What are you willing to do to change the trajectory of your health? One other thing that many patients are not getting that should get is a diabetes education, diabetes educator. So they really need to have a session with a diabetes educator. Registered dietitian is great. Not all registered dietitians are certified diabetes educators, but that's a great start. Now, a lot of times there are nurses that will do the same type of education. But again, as I said, it starts with food. But outside of the food, it's your lifestyle. If you're on a computer all day, during the pandemic, there were so many people that were just kind of stuck on in the house on a computer, and they could gain the COVID-20, as they say. So how can we combat that? Well, there's a lot of things you can do in the house, just getting up from the computer every 30 minutes and taking a few steps and sitting back down help keeps the blood circulating, because it is said that now sitting at a computer for hours on end is the new smoking. It's just as detrimental to your health as smoking. So we mentioned that diet is everything, and there are certain carotenoids, as they say, certain vitamin supplements. People talk about how carrots are very important and good for the eyes. Well, there's a lot of vegetables that are very good for the eyes, even more so than carrots. Green leafy vegetables, squash. If you go vegan, chances are you're doing pretty good in terms of nutritional supplements for the eyes. We have so much technology in our office that we've invested in for early detection of changes in the back of the eye. So what causes one to lose sight from diabetes is bleeding, swelling, and scarring in the back of the eye. Those are the things that cause permanent vision loss. And one thing that we're noticing, the research has shown that you have nerve damage, early nerve damage in the back of the eyes, and it may not affect your vision, but we can pick it up with some of the specialized technology that we have. Pick up this early nerve damage from diabetes before you get bleeding, before you get swelling, before you get scarring in the back of the eyes. When we see that, those are times we can act upon. I can show it to the patient on the screen. You have thinning of the nerve fibers. We don't want to see that progress. We got to get to work and work with your primary care physician or your endocrinologist to get your diabetes better managed. So those are the things we do early on. We don't want to see people get injections. So there's a very good technology, very good in medications that they inject into the eyes that help control and reduce the swelling. So that has saved the sight of so many people, medication injections in the eye. But our goal is a little bit better than it, not better, but it's a little bit more proactive than that. And that's, we don't want to see people get to that point. We really work hard. But if they do, we have options. So with that being said, I've spoken enough for today, and we will continue our discussion about preventing vision loss from diabetes and living your best life. So it starts with what you eat. Food is your best medicine. Lifestyle, just being active and moving, and also making sure that we see you as we direct to make sure that your eyesight is and stays the best, because we want you to be well, see well, and be blessed. This is Dr. Ansel Johnson. Have a great day.